Very good morning to you. We are live at EANM TV and my name is Roy Shepherd. I hope you've been having a great time. We've got people streaming in this morning for the first sessions. I have to say, nuclear medicine delegates are always extremely keen to be here in the morning, even though quite a number of them are looking a little bit fragile this morning, but not our guests. We're going to be talking about EARL Theranostics Center of Excellence Certification this morning, and we've been joined by Iva Hristova, who's the EARL Chief Scientific Officer in the EANM Executive Office, and also someone who I've seen many, many times before is Ken Herrmann, who's the Chair of the EANM Oncology and Theranostics Committee. So, Ken, if I can start with you, explain very briefly what EARL is. I'm sure everybody knows, but can you just give us an overview of why EARL exists in the first place?
So you already mentioned that nuclear medicine is growing, which means, first of all, we start from a very heterogeneous point. We have many different countries, we have many different levels of nuclear medicine, and the idea is to make sure that whatever we now grow in our field is more or less comparable in different countries and different levels.
So the harmonization.
Exactly. This is the direction of the EARL, and started with PET actually and SPECT imaging, and now we actually go into therapy, which I think is even more exciting.
So how much of EARL's work in terms of harmonization is about bringing on board countries where, you know, I've looked at a map of where the centers are, and there are some areas that are like deserts, there is nothing.
It's actually both. First of all, in the advanced countries who believe that they're advanced, to make sure that every center is having a certain minimum of standardization. And the second one is exactly what you just mentioned, making sure that in the areas, in the initially white dots, that if we started, do it right from the beginning. All
right, so tell us, why is it necessary to have a certification program? And there are two different levels, aren't there?
So for, talking about the therapy diagnostics, the first thing is really to make it easy to enter, to get a certification. It's more or less almost like all comers. You have to have a certain level.
But if everybody can do it, what's the point of a certification?
First of all, that you really get informed, that you get connected, that you start a community to interact with each other. And then again, it's always, the first level is always a starting point. You should not stop at the first level, it's where you start. Then you go to the second level. And this is why we have a couple of levels. The second level was just recently released, but the idea is eventually that everyone has opportunity to go start level 1 and then climb up the pyramid.
Okay, Eva, tell us, level 2, describe level 2.
So level 2 is actually for those centers who show variety of therapies together with imaging. We have certain criteria that we have put in there that distinguish those centers. So they have to have PET-CT accreditation, they have to have minimum number of therapies, and they have to have certain variety, which is very important.
So
and
they would be established centers?
That is correct, and this is why level 2 is called advanced.
Right.
It's an advanced center of excellence.
And you don't have to have level 2, you don't have to have level 1. So
no,
can you explain
do not
why?
have to. So level 1, as mentioned, Ken, is for everybody that wants to join the program and wants to show the world what they do. Level 2 is those that are very advanced. They do therapies that are not usually done in level 1, and they do a lot of therapies, so not just a few per year, but they do hundreds of therapies. So they're very experienced, and usually those are also educational centers.
So who is this for? I can't imagine a patient saying, I need to check what the certification level is.
Actually, you underestimate that. Patients are very well educated, and they really go around, they're very well connected, and certifications do play a role, but this is not our primary intent. The primary intent is really bringing together the different key players who are interested in making sure that we have a certain entry level, which is guaranteed, but then also showing them how to actually go promote to level 2. And Eva, I'm not saying anything secretive, hinting that we are going to also eventually implement the level 3. So it's really a process, we are building it, it's building a community. It will take a couple of years. You start with level 1, you potentially move forward to level 2, and eventually we might even offer level 3.
So what would you say are the overall benefits? I mean, we talk about harmonization, and I can understand instantly that that is a really good thing. But what are the benefits to nuclear medicine as a discipline, but also for people who work within those centers?
So there are many. So first of all, when you think about clinical studies, we now see a lot of new clinical studies coming. It's very difficult to pick the right centers. Such accreditation makes it very easy for interested parties to select well-trained, well-prepared centers, one thing. Second thing is, like I said, in many countries we really start with therapy. We really start more like from scratch. How do you train these people who are interested? How do you interact with other players in the field? And this community, it's really a community. It starts with a certain qualification. It's a constant information flow. It gives the opportunity to exchange. It gives the opportunity to train. It's also going to be enriched by a number of webinars. So I think it's much more than just a certification which you put on your wall and then after 2 years you pay again and continue. It's really an education. It's an ongoing process. It's a, how you call it, it's a living accreditation.
All right, so Iva, you've been involved in these areas since about 2011, I think?
That is correct.
Right. So what's the evolution that you've noticed?
So initially the EARL accreditation was rolled out, the PET-CT accreditation was rolled out in a multi-center study back in 2011. And we started with 11 centers, only across a couple of European countries. We now have more than 900 accreditations across the globe. So EARL accreditation has evolved tremendously. We started last year in the summer with the Theranostics Certification Level 1 with a couple of centers in Europe. We're now global. We have more than 100 centers. So the entire network of accreditation and certifications, it's growing by leaps and bounds, the same as the EANM Congress and all of the people that come together to bring nuclear medicine's growth, basically. So tremendous growth.
The certification program was designed for the EU and EU members, because it's a European association. Why is it being taken up by so many other places around the world when they're not part of the EU?
We want to be global. We're not exclusive for Europe, basically. So we want to be global. We want to make sure that when clinical trials are run globally, that there is a standard, minimum standard that has been reached. And nuclear medicine is not bound to grow only in Europe and service only
So why
Europe.
is it not growing then in other countries? And obviously North America is the first one that you'd think of.
Well, we do have centers in North America as well, Canada and US and Mexico, so we definitely are there. We have our footprint there.
In addition to this, you have to understand that Theranostics is a world-growing specialty. And of course, there are also other areas in the world who have their own accreditations. So for example, the US has a certain accreditation. I think next year's is really where we really well understand how we streamline them, how we maybe accept or how we make
It's a harmonized word again.
Again, harmonize on a harmonization level. But no, it's a good point. It's an excellent point. Also, something I really need to emphasize is I like a lot of people are now really absolutely thrilled by Theranostics, but have no experience. So you start and you have a white piece of paper and you say, how do I do it? The accreditation gives a good idea of what you have to do to start with it. So it's really both. It's one side you harmonize and you give a certain standardization, but you also give people guidance to actually build something.
So they are sort of the equivalent of your own guidelines within guidelines.
It's even more. It's actually the guideline of the guidelines.
Where do you see this going then? What's your timeline? I mean, you broke the secret of possibly a level 3, but what is it that you want people to actually do if they have the authority or the responsibility for getting a certification?
We want them to show the world what they can do as soon as possible. We want them to get on the maps. We have different maps for accreditation, for certification, and the bigger the community grows within those maps, the more advanced it is globally and harmonized the nuclear medicine accreditation and certification.
So who are the specific people that you want to engage more with?
That would be all of the PET and SPEC centers and all of the Theranostics centers. And sometimes it's the same center and sometimes it's different centers.
And should the drive come from the clinicians or should it come from the scientific community?
It's a teamwork.
It needs to come more together. Serious in this, to be honest. Theranostics is super cool right now, right? But we're competing with CAR T cells, we're competing with ADCs, we're competing with TKIs. Super. If we want to make this therapy a long-lasting success, it must be widely available. You must be able to do the treatment in Germany, in the US, but also in the Philippines or somewhere in the middle of Asia. And to secure this, and to really also secure the future of our specialty, we need to have standardized treatment. And for us, coming back to the point, we need to involve everyone. We need to make sure that this is not going to be 100 centers, but eventually 1,000 centers. And we need to make sure that a patient everywhere gets the same level of care. And if we don't do this, if we don't do this right, we will not survive.
All right, so I mean, that sounds a little bit ominous. It seems to me, though, that this is on a growth trajectory. What would you like people to do if they want to know more?
They just need to reach out to us. They come on our website. That's the starting point.
The EANM or the EARL?
Our website.
Right.
But EANM, of course, also directs to our website. Reach out to us. Let's set up a call and let's discuss what you need in order to accomplish the criteria and either go to level 1 or level 2, and level 3 is coming up, as Ken mentioned.
All right. Thank you for joining me this morning. Have a great day today. Be good to see you. And that's all from EANM TV for this morning. I hope you have a very productive day, that you're going to learn a lot of new stuff. So many sessions going on today. People are already telling me that it's a bit exhausting, but have a great day. See you next time.